Next up, we're going to get into the Thomas and Obers test. So for the Thomas test, I would like you to be seated at the edge of the treatment table. For most of our normal-heighted patients, they're able to get their feet down to the ground. But for the rest of us, we say keep your feet on the little footstool. Please take your knee, bringing your knee in towards your chest. Good, both hands, both. Keep it there. I mean, come on, an athlete of your caliber should be able to keep your knee there.
Oh.
Keep this there. Okay, what I need to do now is maintain good flexion in the lumbar spine as well as the hip, and lay down. Hold that hip there, hold that knee there. Now what we're trying to see is, does this thigh maintain parallel with the ground? That's pretty good, right? Feel a little bit of pulling, don't you?
Yeah.
Notice when I give a little provocation, a little tightness in the front of that hip. Agree? Agree. Now, the normal Thomas test would allow this knee to flex to 90 degrees. She's probably smiling because she doesn't want to admit that that hurts. Okay? Also, while you have someone in the Thomas test, you can roll the hip in a little bit, roll the hip out a little bit, and you get a little indication. Do you think that hip is tight?
Yeah.
I mean, I'm just rolling it, and her whole person is rolling. Watch that knee. Look at that. Now we go this way. So certainly this is somebody who probably would benefit from some flexibility work. All right? Thank you. Good job on the Thomas test. Now we go to the Obers test. So I'm going to bring the pillow down just a little bit. You're going to be on your side facing towards the wall. Now slide your bottom forward. Thank you. Bottom knees and the top knees, both knees are bent. We're trying to create a straight line with this hip over the hip. Right there. We will lift this leg up and you'll hold that there. You can hold that there. You're strong enough? Barely. But you are. All right, let's hold this hip there now. Lower your knee down to the treatment table. Now, because of a little tension in the IT band, it didn't go all the way down. Agree?
Yeah.
So again, we have a candidate here for flexibility. So let's hold that there now. Hold it. Now lower that down. Lower, 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 lower. Ah, see how it's a little tight?
Yeah.
Now while we're here, we're going to do a little strength test demonstration. You can slide all the way up the treatment table. All the way up the table. And on your side, let's face that way. Okay, we're going to do a hip abductor strength test. We're going to hold this right here. And we're just going to say, you feel that leg is straight? Hold that there. Don't let me push it down. As soon as this machine warms up. Okay, ready? Hold. And that's pretty strong, isn't it? Yeah, it's 34. But did you notice how much more her hip flexed while she did that? Look at that. Needs to be straight. That probably feels behind you though, doesn't it?
Yeah.
Because of tightness. And this is really common. Our hips are so tight. We spend so much time sitting, not enough time doing prone activities and stretching our hip flexor. So hold that there now. Right? You see that's a little weaker now. Ready? Hold it. She's trying. Pretty good effort there. And it did go down to about 20. So,
Oh, it hurts.
and it hurts. That muscle right there, the one that you need to stretch. Of course. We'll get into the stretching in other videos that are a part of this course. Thank you.
Wow.
It hurts.
What's the point?